Okay, thanks again for waiting, everyone. We're going to get started. People can trickle in as they come. So hello, I'm Zach, and I'm going to be your MC for today. Thanks again. So thank you all for joining us for our first ever online knowledge exchange forum. While this wasn't our initial venue to host the event, we're really excited to have been able to connect with you all today. Before we move ahead with today's event, we wanted to take a moment to do a land acknowledgement. We'd like to acknowledge that the Asian Community Aid Services has the utmost privilege of working on sacred land that has been a home and hunting grounds to Indigenous people for thousands of years, including the Mississaugas of the Credit River, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. The territory is part of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Haudenosaunee Confederacy and Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We also recognize that today, the meeting place of Toronto is still the home to many First Nations, Inuit, and Métis people from across Turtle Island, and we are grateful to have the opportunity to live and work on this land. As we continue to grow in our work at ACAS towards reconciliation, we express our solidarity with the Indigenous people of this territory and are dedicated to the work needed to combating racism, specifically anti-Indigenous and anti-Black racism, and stand in solidarity with their ongoing struggle for land and self-determination against settler colonialism. Next slide, please. So before I dive into the agenda items, I wanted to walk you through the main objectives for the day. Apart from allowing ACAS to share some of our findings, we really wanted this to be an opportunity for discussion as well. We have a very diverse group of presenters and audience members working in various sectors. So we wanted this to be the start of conversation in how we can collectively work to better support Asian international students who identify as gay, bisexual, or MSM. So a quick overview of our time together today. We'll begin with a quick testimonial from Sucre, who will share some of his personal experiences as a previous international student. Hopefully his words can help contextualize why we're doing what we're doing today and the importance and need for this focus. We'll then follow up with a presentation by Kai, Liam, and Sucre about the Needs Assessment Project, just to highlight some of the main findings. After this, we'll have our esteemed panelists introduce themselves and share a little bit about their work and insights into working with gay, bi, and MSM, Asian international students, after which we'll open it up for Q&A and discussions. And finally, we'll wrap up with a quick review of some of our discussions and next steps moving forward. And before we get onto that, I'm just going to share some very quick ground rules. So as a community-based agency, we're working to center lived experience as a valuable and valid source of information. So we'd like to ask folks to respect that when we have our conversations. And in terms of questions, if you have any questions, please send a message in the chat that you have a question to ask. You can include your name and just mention that you have a question to share, and then we can call you. Or you can send us the question and we'll do our best to make sure it gets answered during the Q&A. And in terms of airtime, if you notice that you're speaking a lot or asking a lot of questions, we'd like to kindly ask that you allow others room to speak as well. Next slide, please. So without further ado, I would like to introduce Sucre.
Hi, everyone.
Hi, Sucre.
Okay, I'm Sucre. I'll be sharing parts of my experience upon arriving in Canada from China. So I'll begin my story. I arrived in Toronto in 2012 from a small town in northeast of China. So for me, Toronto is the first city I lived. And to this day, it is the only city I stayed for more than 3 months. I would say now Toronto is my home. My first impression for Toronto was everything is so far away. If you don't live in downtown, you will definitely need a car to get around. Getting grocery, for example. In my small town back home, there will always be a convenience store downstairs of your building. They charge you regular price. And here, convenience store charge you a bottle of water for $1.50, where you can spend $3 for a box of water in big supermarkets like Walmart, Loblaws, $2 if it's on sale. So a lot of times, because I was living in Scarborough in 2012, when I go shop for grocery, I'll have to choose if I want a carton of juice or a jar of cooking oil, because I cannot carry both with other produce in my hands, walk for 20 minutes. So that's something new to me. In terms of language barrier, I can still remember the moment I was dropped to my homestay. I understood what she was saying, but my mouth was just couldn't form an English sentence. Oh, and here's something funny. You know, there are business and residential buildings where they put a sign saying smoke free. So one day I passed by a sign stating such. I was like, ooh, developed countries differently. You can just get free cigarettes. For me, I don't smoke, but I love to see how to get one. So I was wandering around for a good 5 minutes. Then the security guy came to me. He asked what I was doing there. And I said, I'm looking for free smoke. And here comes to the best part. He gave me a cigarette. So for almost 6 months, I believe this is the way it works here. You can just get free cigarettes where near signs saying smoke free. Until one day I shared this secret with a friend who smokes. Then he head to the very same building. Of course, it didn't go well for him. I mean, life here by myself could be very free without my parents. But there are aspects I may not be ready for. In 2013, I met a guy, and he made his move into my feelings. But soon I realized that there's something wrong. Turned out he was betrayed by his ex. Then he became this non-believer for attachment or commitment. But he's still human. So I was receiving good morning, good night texts and spending good times with him. Then the next second he'd be like, oh, no relationship, blah, blah. That's totally inconsistent behavior. But I was fairly new to dating. I thought time plus my effort would work. So I spent lots of energy on him, even when I'm traveling back home. I still text him with all the positive thoughts. It was like I say, honestly. He would reply saying, wow, that actually did allow him to look from a different side. Then his next text is, but no, no relationship for me. I didn't know when to give up. I couldn't tell my parents in China about this. It was the second year I'm in Toronto. I didn't have anyone to get advice from. So I've endangered myself into a situation where I was depressed. Waking up in the morning thinking, what do I do today, was the meaning of life. It was quiet in my room, and it was dark in my heart. So I told him this should stop, and I cut down all possible ways for him to contact me for a good 5 months. Then one day, I don't remember where, we reconnected. I thought I was okay to meet him as a friend. I was naive. 5 months distancing was worthless. He was in a white shirt. All the memories came back. My feelings for him was as strong as 5 months ago. When I'm back in my place, I called my mom. I was crying so hard, and she was doing laundry. The machine was so loud, and when I told my mom what's going on, I reframed him as an older girl. But the call only allowed me to cry, to let out. Mom couldn't help. She didn't even know what really happened. And I regretted it immediately because now she's going to worry about me. It was a difficult time for me. I wish there could be someone I feel comfortable talking to, or just distract me from getting too deep into this. I'll also share a story on accessing healthcare and insurance. In 2014, I was in Georgetown College, have a group of friends and a girl named Christina. She has some problem, might be lack of nutrition, I can't remember what's the cause. So when the final approached, one day, she fainted in her room. Then the roommate called ambulance. We got to know this when we saw her in school. And she told us the ER visit cost her nearly $2,000. The school insurance can cover about half of it. That was a huge bill for her to pay. A few days passed. She still felt lightheaded occasionally. One time we were in school library. Her face looked pale. Her voice was weak. We were afraid she's gonna pass out again, she said. I'll be fine, just resting a bit. No ambulance, please. No ambulance, please. We were laughing so hard. But then it was also the cold, hard truth. So we told her we can share the cost, but if you feel unwell, you gotta go. She said she has already used up the insurance for that calendar year. So she cannot really be seen by a doctor, at least not in Canada. But the bright side is she's fine now. These stories are not rare, and it's just one part of the experience for an international student when they are adapting into a foreign country, a new lifestyle. So hopefully later when ACAS team presents the needs assessment results, we can highlight more of these experiences through the interviews and our findings. Thank you.
Thank you, Sucre. We're going to be moving on to the next portion of our forum now, which is the presentation of the needs assessment findings presented by Kai, Liam, and Sucre.
Gotta remember to unmute myself. Hi, everyone. My name is Kai. I'm the project coordinator for this needs assessment here with ACAS. And thanks again so much for being here with us today. It really is such an honor to have such a diverse audience with us, but also really to have this opportunity to share some of our preliminary findings for our project. And so just in terms of what we'll be covering today, we'll be going over quickly the background of the project and how it came to be. What were some of the things that we did to carry out the project? And then afterwards, I'll invite Sucre back and also Liam, our two peer workers, to join me in presenting some of the findings. So next slide, please. So how did this project come to be? Well, in early 2018, various agencies, clinics, and community partners actually identified that there was a significant increase in the number of international students who identified as gay by MSM who were testing positive for HIV here in Toronto. Specifically, one example, the Hassle Free Clinic in the first half of 2018 reported that 40% of all their positive cases for HIV were amongst newcomers. And those were people that didn't have immigration status at all, but also those that were on student, visitor, and work visas. And when they teased out that number a little more, what they saw was that 15% of the people diagnosed with HIV in their clinics were in fact gay by MSM international students. And even then, within ACAS, we saw of those who were accessing our support programs for folks living with HIV, we had 22 clients at that time who were currently or recently graduated international students. So at that time, ACAS, we wanted to develop more relevant and accessible programs for international students. But what we found was that there was extremely limited research on the subject matter, and especially within the Toronto and Canadian context. And so in order to make a more meaningful impact in this area, ACAS decided that the first logical step really was to conduct a community needs assessment. Next slide. So in preparation for the needs assessment, while there was limited research, we were able to draw upon our organization's existing work with queer Asian international students, as well as some of the work being done by community leaders and volunteers and partnering organizations, and we were able to identify some initial challenges or barriers that international students faced. And that included everything from limited knowledge and awareness around factors that increase HIV risk, but also the skills needed for risk reduction, for example, those were limited. In addition to that, we also identified that language barrier was a significant challenge. not just in accessing HIV services, but really navigating day-to-day life and also accessing community programming and anything that would permit for more community building. We also noted that there was lack of linkages and access to culturally competent care for East and Southeast Asian international students. And also we noted that the overall migration experience, including things like culture shock and adapting to newfound freedoms and responsibilities of living alone for the first time, and subsequently also losing all of your immediate support networks that you are used to, all have potential impacts on the international students' well-beings. And in addition to that, I think pretty prominent issues that also persist that might not necessarily be international student specific, but cultural stigmas around HIV and sexuality was a significant issue, which would result in a fear of disclosure to peers and family due to issues of like guilt and shame. And lastly, limited health coverage. International students specifically are not able to access OHIP. And we also noted that health insurance limitations, as Sucre also shared in his story, is a significant issue and barrier that they face. Next slide. And so yeah, when we tried to look at, what were the available resources, who were the people that had the most access or who were interacting most with the international students, OHTN helped us actually identify what some of those resources were, and we found that provincial and federal government websites actually lacked the comprehensive and culturally sensitive information needed with respect to sexual health, especially with regard to the background of international students and where they were coming from. In addition to that, while post-secondary schools do in fact provide a lot of links and resources to sexual health information and resources in the community, it was not helpful to actually help students to be more proactive about their sexual health. Next slide. So basically, taking all this, we set out to conduct our explorative needs assessment project, which specifically aimed at looking at the needs of East and Southeast Asian gay by MSM international students, specifically who have studied or have recently completed their education here in Toronto. And to do that, there was a few core activities. So first and foremost, we did outreach and promotion work to recruit participants for our project, including attending orientation events, international student offices, going to their health centers and campus groups to do promotion. We also leveraged a lot of online and social media work. Specifically, WeChat was a huge venue for recruitment, surprisingly. Especially in the age of COVID, that was a significant approach of how we did that. And then we leveraged a lot of our existing programs here at ACAS as well, including the men's programs, Asian Bathhouse Nights, for example, as ways to recruit participants. And from there, we were able to recruit 11 participants for the interviews, and we really explored each of their experiences as international students living here in Toronto. So we looked at things like their struggles on a day-to-day basis, or their experiences like establishing connections and community here, their experiences dating and hooking up, and also what were some of their experiences specifically accessing healthcare and social services here. After that, we did a preliminary thematic analysis of all of our interviews, and we used some of those findings to actually guide the development of our survey. And that resulted in a massive 65-question survey. How we got 100 people to fill that out, I don't know, but that included collecting demographic data collection questions, as well as various measures on trying to explore some of the themes that we heard with respect to what were their concerns and actual experiences. Next slide. So now I get to move on to probably the more exciting part of the presentation, which are the findings. And so from our project, we saw the emergence of 7 main HIV prevention needs. And we're going to be focusing on the HIV prevention needs specifically for the purposes of today. And we're about to go into each individual one in a second, but as you'll notice, a few of the ones that are listed actually match what we had predicted would be, or what we had known from our own work as barriers, including lack of HIV awareness, knowledge, cultural stigmas, and loneliness. But what we did see emerging as unique needs were the difference of perspectives and use of healthcare across cultures, PrEP access needs and perceptions versus the actual experiences of accessing PrEP, and substance use. So we're going to delve into each of these needs, and then we'll be sharing some of the survey results, as well as some of the more illustrative quotes, I guess, that can highlight some of these ideas a little more. So I'm going to pass the mic over to Liam now, who will be presenting.
Hi everyone, I'm Liam. I'm an international student too. I have some kind of problem when moving here, Toronto. Different culture when you over with the family hit me so hard. And I feel so alone when get used to with the Toronto. I believe not only me, but also many international students have to deal with the loneliness on the very first day in Toronto. As you can see on the court, one of our interviews said that he feels homesick and needs someone to take care of when he got sick. And we also had the various measures for loneliness and isolation in our surveys. The first graph you can see here, we asked survey responders to rate how strongly they agree or disagree with the statement. Even around people I know I don't feel belong. It's a little hard to tell on the graph, but 41% of survey responders indicated that they agree or strongly agree with this statement. In another question, where we asked respondents to raise how concerned they were about various areas in their life under feeling connected to others, 57% of respondents indicated that they were in fact concerned or very concerned about having a feeling connection to others. So our finding do subtract that international students are concerned about loneliness, and our survey when we asked participants where they would or would not access ACAS services. Participants frequently said they wanted to access ACAS to meet people, to say experience, to feel connected to others. So that about loneliness. So we move on to the next slide. In another area, we saw that as a need or challenge for international students, it culturally ingrained stigma about HIV and being gay. As all the participants are from East or Southeast Asian countries, we heard that HIV/AIDS and being gay are strongly connected to each other and also a taboo subject there. We heard that influence of dominant religions, you can see in the quote, and how that contribute to fear, therefore also impacting willingness to learn about HIV and to get tested. We also commonly heard about HIV linked to being gay, therefore intersecting and compounding their effects on international students. Another common theme that very concerned that many of our interviews talk about not wanting to come out to their family because of family obligation or concern about their family face. It reflected in some of our data, survey data as well. When we asked them what were some men concerned about coming out, of those who responded, 67% of respondents indicated that estrangement from family was the most concern, followed by family abandonment, estrangement from friends, and the last one is financial repercussion. So we feel like in order to improve international student experience accessing HIV resources in healthcare, we need to aware of their unique challenge. 50% of responders indicated that very important, extremely important that to have access cultural relevant services. So I will pass to the Sucre for the next part.
Thank you, Liam. Lack of HIV awareness knowledge upon arrival. When we look at the response on the bar graph, the yellow and the blue bars represent agree and strongly agree. It shows, however, a conflicting result from our interviews. From multiple interviews, we would hear how HIV knowledge was a challenge for many of our participants, where majority people in the survey say they feel confident about their own knowledge and awareness around STI and HIV. So we looked at our survey respondent information and saw that the average time of residence in Canada was 3.7 years, meaning those who responded to our survey had already been here for an extended period of time, and therefore might have had time to learn about sexual health. One quote that we felt really highlighted this experience is shown here. Our participant talks about the first 2 years of his time not being aware of sexual health or testing, He didn't know what is XTD, only introduced to testing clinics by his friend 3 years after his arrival in Canada. So from this, we believe that when reaching international students, we should begin to look at earlier opportunities where we can begin to reach out and raise awareness for international students. For example, there could be a welcome package given by their educational institution. It doesn't have to be a course on sexual health, but it can be something like a checklist. Name one STI testing spot near you, or what is HIV and how does it transmit? Because the international students begin their study in a foreign country, the schoolwork itself is already overwhelming. So if nobody mentions HIV, STI, and I quote from the participants, if you don't know, you don't even look for it. You don't look for anything. And moving on to the next slide. Another major area of concern for international students that we saw was their experience navigating healthcare and social services. The first obvious concern is the issue of language barrier. We saw 44.6% of survey respondents say that language barrier had been a problem for them when accessing healthcare. We also saw an interesting result in our survey that 49% of respondents indicated that they were concerned or even very concerned about healthcare access. And some of the concerns that we heard apart from language barriers include costs, long wait times when trying to access mental health services, and negative experiences accessing healthcare. For example, if you look at the Singapore guy quote on the left, at the bottom, he says, "So he gave me the pills and he jabbed me and I didn't know what those were." That could be scary. He was not sure what he had and he also didn't know what's the injection for. The nurse, the doctor probably explained to him with some medical terms, but like the rest of newly arrival international students, he was having difficulty understanding it. Then on the right is another supporting quote from a Hong Kong guy. Next slide, please.
Okay.
So another interesting finding in our NAES assessment was that international students approached healthcare quite differently, including only accessing healthcare when they were sick. Therefore, they would not seek out healthcare unless they feel ill. So there is no need to find a doctor before they are sick. Looking at the quote above, he said, "I don't understand why there is someone to keep track of my health. That should be me." As an international student myself, when I heard the term family doctor, I had the same confusion. How does it work? Is it like your whole family goes to the same doctor for everything? That's why it's called family doctor. And if so, does the doctor go to your home? Then you are treated like royalty. In China, we do medical exam at school. The school would have a medical team on campus for that day. That's how preventative care is done in my elementary school and high schools. So the concept of having a family doctor is alien to us as in international students upon arrival. And here I'm throwing out a fact that many international students would bring their own medication from their home country. Me for one, Liam as well. And this is not a single case. And the reason being, when you need a drug here, you need prescription. And in order for you to get a prescription, you need to see a doctor. Then you call, schedule appointment. On a normal day, appointment could take about 2 weeks to get. And then you get the prescription, you bring it to a drugstore. Sometimes the drug is not available. Then they'll be saying, come back next Monday after 12 p.m., pick it up. So after all this, you got your drug, but still, you are covered by school insurance. You would want to get reimbursed. So you have to look into the process how. And frankly, school insurance are not user-friendly. I had to submit my receipts by mail, not online, and I just gave up. So all this process here in Canada to get a drug, where when I was in China, you can just walk into a drugstore and purchase. 2 minutes, done. I'm not proud of self-medicating, but this is more of a cultural difference. And the last point we'd like to bring up is the wait time. I believe people are well aware of this, so I'll just quote this Singapore guy. He needed counseling help. Then they asked him to come back tomorrow. He said, tomorrow my mood is going to be up. Why would I come tomorrow when I need you right now? Okay, that was a pause for dramatic effect. Now I'm passing it back to Kai.
Thanks, you're great. So yeah, our second last area that we wanted to chat about was the varying perspective and experiences of accessing PrEP amongst Asian gay bi MSM international students here in Toronto. So from our interview, first thing we wanted to talk about was just the awareness. So from our interviews, pretty much everyone, 10 out of 11, I would say, of our interviewers said that they were actually aware of PrEP as a HIV prevention tool, which is great. But one thing that we did probably want to make a distinction about is the difference between awareness and actual knowledge of it. And we only say that because one of the interviewees talked about how he was able to access free injectable PrEP on campus because he's a queer man. And it became quickly clear that he was talking about the HPV vaccine. So it's just like those small little things here and there where it's like, while there might be awareness, there might need to be more knowledge building that goes on in that front. But moving on, even though there was high awareness of PrEP as an HIV prevention tool amongst our interviewers, only 3 of them actually indicated having accessed or previously accessed PrEP in some way. And these stories really span the spectrum from positive to negative. But we thought it would be important to kind of highlight these discrepancies and what those potential factors might be. So for example, in the first quote to the far left, this is just about as positive, I think, as it can go. This person talks about how he attributes this positive experience to being linked to a supportive healthcare provider early on who is aware of the struggles of international students. He also talked about how between his healthcare insurance coverage as well as the subsidization of PrEP that he was able to get, he was essentially getting it for free. So I think, again, that's probably as positive as it can get. But then when you look at the top right quote here, this person shares a relatively positive experience where even though his insurance didn't cover his PrEP, between receiving some sort of subsidization for it and I guess like a motivating factor for the peace of mind that he kind of talks about, he's able to and is willing to pay for PrEP out of pocket. So again, that's another interesting fact that we found. And lastly, we had a final participant share with us a rather negative experience when accessing PrEP. He shared how the process was not only long and complicated, but his insurance didn't actually cover any of it. And even after going through the entire process and paying for the PrEP, when he ordered it, it actually never arrived. And when he tried to consult his doctor about it, the doctor wasn't able to necessarily support him in that manner. So it seems like this combination of negative experiences was significant enough to deter him from future access of PrEP. And I think that that's something that needs to be considered and what we can do. So basically from all these stories, a few things that we want to point out was that PrEP access experiences clearly vary greatly between person to person, and some of these factors might be the result of how much their insurance actually covers, who their doctor is, if they even have any, and also financial barriers. And then on top of that, we feel like there could be more work done, like I said, with respect to knowledge mobilization and around PrEP for the community. And last but not least, it seems like there would be benefits to helping international students becoming more aware of how to use their PrEP coverage, if at all. And if there isn't, perhaps linkage to some community programs that might be able to alleviate some of those financial barriers. Next slide. And so the final area that we want to highlight as a need or area worth considering in future work with Asian gay bi MSM international students is substance use. And we as a team felt like this was really important to highlight because there seems to be this misunderstanding or misconception or stereotype even that Asian folks don't use drugs. However, our project, I think, really contradicts this. As you can see in the top left graph, when we asked folks whether or not they've used recreational drugs since arriving to Canada, almost a third, so 31.5% of folks indicated that yes, they have. And the most commonly cited drugs that were used were marijuana, poppers, and methamphetamine. And so we have some quotes here as well that I think kind of do a good job highlighting the points we're trying to drive home in this area. But specifically with respect to substance use, one of the most common themes that came up was the cultural stigma around drug use. This person kind of talks about how, you know, if you're caught using drugs, you're kind of seen as deviant or a crazy person. But then this would almost always be contrasted with how they compare their experiences here in Canada. And usually Canada is talked about in more, being more liberal and accepting here with respect to substances. And when it comes to the culture, I think it's important to emphasize that it's not necessarily a culture of peer pressure, but really it's this kind of attitude amongst their peers and this openness to talk about substance use that almost kind of, I want to say, like, gives permission for a lot of people to explore substances. So I think that that was a really important point. And finally, the last quote we want to share here highlights a story that I think will drive what I'm going to say home in a bit. But this participant shares how he tried to use meth for the first time while hooking up with another guy. And he kind of took it at face value when he said that it was supposed to be very mild. Needless to say, his experience wasn't mild. And he was saying how when he was coming down from it, it was a very negative experience, a very like upsetting experience when he was coming off of it. So after that, he blocked the guy, never talked to him again. But all this to say, I think in this particular area, I think it points to the need for more harm reduction work amongst Asian gay bi MSM folks, especially amongst Asian GBMSM international students. And when that is the case, I think the work needs to be cognizant of the unique migration experiences of international students while also being sensitive to the cultural backgrounds of the folks involved. And that concludes our presentation. So we're going to save the Q&A for the Q&A section. So if you have any questions, we would love to answer them. But for now, I'll pass it back to Zach.
Thanks, Kai. So before we start the panel discussion, which will be very soon, we're going to break you out into mini group discussions. So our tech expert, Alex, will be sorting us into groups of 3, randomly assigned. And in these groups, we wanted to give you an opportunity to reflect on what you've just heard, whether it was in the opening testimonials or in the needs assessment presentation, and share some things with your group that stood out to you. After 3 minutes, we'll bring you all back, and we're going to ask you folks to share 3 main ideas that were discussed in each group. While you're in your groups, you'll get a 1-minute countdown before the end of the breakout groups, but please don't press the button that shows up. You will be returned automatically by Alex. Thanks.
It sounds like 1 minute to me. Okay, so everybody's back.
Yeah, how's everyone?
Yeah, what are we supposed to do next to write?
So we were hoping that people could share basically some key things that stood out during your conversations. Yeah. It's okay if you didn't have time to make 3 points, but if you could share them in the chat, then we can try to get to them during the Q&A portion. So yeah, if anything stood out for you, just go ahead and take a moment to type it in. And while people are doing that, we can move on to the panel discussion portion of our event. So I'm going to hand it off to our moderator, Nalini Mohabir.
Okay, thank you, Zach. And can I just say thank you to the presenters so far, and thank you to ACAS for inviting me to be a part of this really important project. And I just wanted, before we move on, just to say a couple of things that that reminds me of how important this work is. Of course, we're in the midst of a pandemic. ACAS was started in the midst of the AIDS crisis. And if there's been a lot of parallels made in the media between then and now, between the way certain populations were segmented, compartmentalized, made expendable during the AIDS crisis, and we see that happening once again during this crisis, except for now we're in a time where we see very clearly the way all our systems are interlinked: the economy, education, immigration, public health, fundamentally undergirding all of this. And just wanted to thank you all for bringing these issues to our awareness. I have the honor of introducing the next set of speakers who will be helping to inform our understanding of HIV prevention among queer international Asian students. I'm going to start off by introducing each individually. They'll have 5 to 7 minutes each to talk about either their research or their community practice, and then we'll be coming together in the Q&A to discuss further. So I will start off with Eugene Nam, if that's okay. Is that okay with you, Eugene?
Of course. Yeah, of course.
Okay, great. Eugene Nam is a young queer Korean Canadian who's currently pursuing a master's degree in social work with a collaborative specialization in public health policy at the University of Toronto. He's been involved in many community research projects and is a national ambassador with the Canadian Foundation for HIV/AIDS Research to support ending HIV in Canada. So over to you, Eugene.
Thank you very much for your introduction. So I'm gonna see if I can share my screen.
Maybe, sorry. Since we are presenting together,
Oh, sorry.
could we maybe
Yes.
get introduced together? Because we will flow into each other's.
I'm sorry, I thought you were speaking separately. My apologies. And I also just realized I forgot to introduce myself. So very briefly, I'm Nalini Mahabir. I'm a professor of feminist geographies at Concordia University in Montreal. And presenting with Eugene is Alan Lee, who you probably all know, is a medical doctor, educator, researcher, community organizer and advocate based in Toronto with over 30 years experience working with marginalized populations, including immigrants, refugees, people facing challenges with poverty, service access barriers, mental health and addiction issues, LGBTQ, and people living with HIV and AIDS. And among his many, many community leadership roles, he was founding president of the Asian Community AIDS Services, so ACAS, as well as the Committee for Accessible AIDS Treatment. Sorry about that, Alan.
That's okay, thanks.
All right, so should I get started?
Yes,
Okay,
please.
great. So I know we're limited with time, so I'm not gonna go deep into the methodology itself. And I think in terms of rationale, a lot of things were shared while previous presenters were speaking. But before I start, I just want to quickly acknowledge our participants, study participants who were incredibly brave and also generous with their contribution. And I want to also acknowledge our research team and then the small grant that we received from the University of Toronto that allowed us to do this research study. I'm gonna be very brief about this study rationale and objective. There was an increase in the incidence of HIV amongst the international students in the Greater Toronto area, and that made us mobilize a team to investigate what is actually happening. And we heard from a lot of providers that there are these access barriers that are experienced by many people, and even the providers themselves are having difficulty navigating the barriers. So we wanted to document what those barriers are. So in terms of the methodology, we hosted two separate focus groups. So one's separate focus group with service providers and a focus group with international students living with HIV.
You might need to ask people to advance the slide.
No, I'm controlling it.
Oh, you're controlling? Okay.
Yeah, yeah. So one thing about, I want to quickly take a look at the demographics here. So
average age of international students, participants were 28 years old. And if you take a look at the time spent in Canada, it's about 3.3 years. And length of living in HIV is 2.7 years.
Eugene, it's not moving. You're still on the title page only on my screen.
Is it?
Yeah.
Oh, that's cool. Is it moving?
No.
Not moving. Okay. All right.
I can give it a shot. Eugene, you sent me the slides if you would like.
I actually changed my slides a little bit, so that's why I was. Yeah.
Oh, okay.
Yeah. Okay.
All right.
Okay. So I can just speak. So basically, the difference between time spent in Canada versus the length of living in HIV is only about 0.5 a year, which means that there's a relatively short period of time, a window period that we need to engage international students before they get affected by HIV. And if you look at, so in terms of a participant demographic, we had about close to 60% of our participants who identify as the East and Southeast Asians. When you take a look at the, so when you kind of envision the pathway to health and well-being for international students, there are four main categories. One is the healthcare access. The other one is psychosocial health, service providers' knowledge, and immigration. And when you have a very simplistic comparative view of healthcare access, comparing individuals with permanent status and with international students, with permanent status, their healthcare access tends to be more consistent. They have established access points, and it's a relatively smoother access process. But compared to international students, so international students, their access points is not well established. It's very patchy, and sometimes it tends to be provider driven, which I'm going to talk a little bit about it more. So in terms of the healthcare access, so I think it was shared already that school insurance is quite inadequate sometimes when students want to access healthcare. And also, one thing to acknowledge is that there is a disparity even within the international students. So for instance, if you are going to a University of Toronto, for instance, you tend to have a better healthcare insurance compared to students who are going to a George Brown or a Seneca College. And of course, if you're in a language school program, or sometimes you may be coming for less than 6 months, that you may not actually have any health insurance. So that so inadequacy with the school health insurance ended up causing a lot of healthcare access issues. So one thing mentioning the lab testing. So if you want to go get your blood test done, some insurance covers it, some insurance don't, and if your insurance doesn't cover it, then you may need to end up paying $500 out of pocket. And also, if you're looking at the physician service, seems like physician service is not as problematic, but what's really what barrier in this context is that not every providers accept health insurance that international students have. So sometimes students may need to travel longer distance to access physician service. So of course, the international student living in HIV, the medication access is very important, and medication is not really covered by many insurance, or it has a very limited coverage. So if you have UHIP, you might have up to $5,000 a year coverage, which probably translated to two to 2.5 months worth of medication. And the other thing is the psychosocial supports. A lot of students talked about how lonely they are, and also combining that with the initial shock from the HIV diagnosis. They felt that they're really lonely. They are worried about their schooling. Their schooling is affected. They can't focus at school. They're worried about what they're gonna tell their family. And in general, being in a new country, the students said that there's a general lack of social support, which made them sort of living with HIV a little more difficult. But what they said was that so peer support is very important, and they wanted to have more opportunities to engage with other students who they can share their challenges with and share their support with each other. And in terms of service provider competency, so when international students are affected by HIV and trying to access healthcare, the healthcare providers' knowledge is very important, because a lot of times, so for instance, a lot of students are actually accessing medications through compassionate access program, through pharmaceutical companies, but it seems like not all providers are aware of the program, nor that they don't know how to initiate the process. So it's important to put together some sort of resources for healthcare providers so they can better support international students when they're trying to access medications. So all of this, a lot of difficulties, especially healthcare access, comes from the lack of permanent status in Canada. And many students shared with us that after being diagnosed with HIV, they actually changed the plan and made a decision to stay in Canada. But they felt that HIV is a barrier to permanent residency. So when we collected this data 2 years ago, medical inadmissibility criteria was about $6,500 a year. So if your healthcare cost is deemed to be more than that $6,500 a year, then applying for permanent residency was quite challenging. Since then, the policy has changed. Now the threshold went up to $20K a year, but I'm not aware of the impact of that policy. Theoretically, international students should no longer have problem when they apply for permanent residency, even if they're living with HIV. But we still believe that there is opacity in the process that kind of creates that fear amongst the international students. Oh, I see my slides.
Thanks, Alan.
Great. So, okay, just to kind of quickly wrap up, international students affected by and living in HIV have really complex needs that require holistic, multi-pronged strategies that address issues along with it just requires a lot of maneuvering and engagement with the different stakeholders, because there's so many different moving pieces that needs to be captured and addressed. And Alan's presentation will discuss how we address these issues in more detail.
Hi. Thanks, Eugene. Oh, now we're back to slide 1. How come? Oh, that is strange. So just picking up from what Eugene has explained, can you all hear me okay? Yeah. So we only had a very small grant of $5,000 to do the whole research, but we were actually able to utilize the research process as well as community engagement to leverage a lot of very important changes. So we wanted to highlight some of the strategies we've used right from the beginning of building the research processes to using knowledge translation strategies throughout the research process to lead to some changes. So first of all, we're trying to connect and build synergies with different parallel processes or community networks that are concerned and interested in the well-being of international students living with and affected by HIV. So there was Eugene actually was working at the OHTN at that time, and he was one of the co-champions of the initiative. So we have inside person and outside person working together, and ACAS and CAT as a community partner championing that. So OHTN developed a international students working group that look at prevention issues as well as support issues. And then over time, it kind of evolves into the Toronto to Zero Newcomer Access Working Group and Linkage to Care Working Groups, which also look at access to care and support for international students and other newcomers or precariously insured populations. So we were able to tie the issues to bigger picture. The Blue Door Clinic, we'll talk in a little bit more detail, which is one of the initiatives that got developed to provide care for people who do not have full insurance or face treatment access barriers. And then Ryan will be talking about another study that is kind of connected, inspired by the student study, which is the Chinese GBMSM PrEP study that we at ACAS been partnering with St. Michael's Hospital to do, to look at the PrEP access, preparedness, and issues related to PrEP use for the GBMSM of Chinese origin in Toronto and in Shanghai. And then, of course, the ACAS international students needs assessment that we are all here to hear about today. So we can maybe highlight a few things. So one of that is the need to develop informational resources. And I think that also get talked about in the breakout rooms and the presentation just now. First of all, for government or health systems to change, we need more evidence to inform the needs and what needs to be done. And then we also need strategies to actually improve the access to care and strategies to improve prevention. So we'll talk a little bit about each of them. So in terms of information resources, throughout that process, we were able to leverage OHTN and other partners to do a lit review on the international students issues through the OHTN Rapid Response Services. And then we also did a health insurance coverage scans for different university and colleges in terms of what they cover, what, you know, a lot of them, I think as Eugene talked about, you know, have very limited coverage. Some will cover the medical services, but not the lab. Some will, you will need to buy extra, pay extra money to buy some medication coverage, and it only limits very little amount. And so on. And then we also have currently the Beyond Blue Door research, which will look at the health data and needs of precariously insured and non-insured people with HIV, which includes the international students population. So in terms of the strategies to improve care access, basically there's three things that we did. So for the communities affected directly, we organize HIV and immigration training for international students. So the Committee for Accessible AIDS Treatment and HELCO work together to organize some training sessions for international students that target specific immigration-related concerns that are applicable to international students. As we used to have an ongoing immigration training, but for this particular one, we actually tailor it to the scenarios that are relevant to international students. The Blue Door Clinic is a drop-in clinic. Well, now it's appointment only because of COVID-19, but it was set up as a no-barrier primary care clinic. So I heard that people are very confused about family doctors concept. So let's not call ourselves family doctors. Let's just call ourselves primary care doctor. So basically, is a clinic that runs every second Mondays at Regent Park Community Health Center, and it will see any person who does not have health insurance or doesn't have full health insurance that enable them to access other healthcare providers. So we will do initial, and it's only for people with HIV, right? So it's not for prevention, not for STI screening. So you can just call and make an appointment, or previously you can just drop in, and we would provide all the diagnostic tests, we will provide all the assessment, initiation of treatment, and follow you and support you until we have, we can find you a long-term stable place to look after your health needs. So that's been happening since August, and actually I would really credit it as part of a direct outcome of the international student research study that we did, because that was actually one of the several big moving forces that make it happen. And then to bridge the laboratory service gaps that Eugene talked about, we actually work with the OHTN to set up a system that, and the OHTN actually has been trying to advocate to the lab to see whether they would cover free lab services for international students. But so far it has not been very successful. So instead, the OHTN then kicked in some pilot project funding to pay for lab services for international students who have some partial health coverage so that they can see other primary care physicians in the community, but cannot pay for their HIV-specific tests like CD4 and viral load. And then they can continue to access those services while have their lab services paid for. And actually, just for information, all the public health lab services, including all the STI screening and HIV viral load, should be covered free by Public Health Lab of Ontario. So you should never be charged for those tests. And then, oops, sorry, one more thing. And then I'll leave Ryan to talk about the PrEP study, and you already heard from the needs assessment. So the other part is, as much as we've developed some needed services to bridge the current gaps and working towards developing better services, there needs to be systemic policy changes to continue their support. So we've been advocating to the drug companies to continue to provide compassionate medication access for students. As I talked about, we've been working with the OHTN to advocate for compassionate lab test coverage, and also lobbying the LIN, the Local Health Integration Network, which is a policy funding agency for the healthcare system, to expand the community health centers service mandate to include students, because currently community health centers are not supposed to serve visitors and international students. So, and it's unconscionable, like we almost have to wait till a student left their student visa and become non-status before we can service them. It just doesn't make any sense to anybody, right? So those are some of the advocacy effort that we've been working on. And also we've been working with another treatment access study in Ontario to work together to lobby for universal medication coverage for everyone with, not just even with HIV, but all the health needs actually. So those are all the advocacy effort related to that. And so I think in conclusion, we've been able to utilize this research process to engage a lot of community stakeholders and make quite a bit of difference. So I think when we come together today, I'm hopeful that we can generate more discussion to create more interventions and strategies that can address more of the needs of the international students. Thank you. And that's our contact information.
Okay. Great. Thank you, Alan. And now I'm going to turn it over to Ryan Tran. But before I do that, let me just introduce Ryan, and just a reminder that we'll be taking questions at the end of all the presentations. So our last one's from Ryan Tran, who's currently the Manager of Education and Outreach at ACAS Asian Community Aid Services. He's a Vietnamese gay man born and raised in Toronto with 15 years of combined volunteer and working experience with queer Asian youth and ACAS. He's produced some of his work, and I'm only scratching the surface, has been around producing online sexual health videos, starting a harm reduction support group, advocating against sexual racism in visual imagery. He's also spent 6 months in Thailand interning with local NGOs to support their work with HIV prevention and education. So I'll turn it over to Ryan.
Okay, hello, xin chào, tân tôi là Ryan. My name is Ryan. I use he, him pronouns, and I work at ACAS, and I'll be talking about a research study that ACAS is involved with, as well as our first-hand experience with international students and newcomers that we see through our programs and services at ACAS. And actually a lot of the themes that we see have already come up in everyone else's presentations. So that's great to see. And I'll just keep it short and cute. So the research study, at least, that we're part of is the Chinese Gay Bi MSM PrEP study. And it's a study looking at the acceptability of PrEP and feasibility among Chinese gay, bisexual, queer men who have sex with men between the two cities of Toronto and Shanghai. So the study is led by Daryl Tan, Alan Lee, who's also here, of course, and Tony Zhang in Shanghai. So ACAS's role in this study is in the outreach and recruitment of survey participants with a goal of at least 100 responses from Chinese MSM here. And then we also want to ensure that we reach a diverse population of Chinese guys. That would include an age range, immigration and citizenship status, and also identifying as Chinese can be broad to include different countries like Hong Kong, Taiwan, and Singapore. And currently we don't have any concrete results yet because the survey is still open. So we have the flyers up here. This is a new survey link as well, in which I believe we will probably be sending out after this presentation. So please do, if you know any Chinese gay queer men in your services, please forward it to them. And so even though we don't have results yet to look over, I do think that there's going to be a lot of interesting things from the study as we compare both cities and how the local context will shape the survey and the responses we get. So both cities are big metropolitan cities. However, Shanghai has a higher population density. So they actually have a higher goal of 400 responses. And we also expect that the LGBTQ climate and social acceptance will affect how well PrEP is accepted and delivered in Shanghai. Of course, PrEP isn't as readily available yet in Shanghai, but we do believe some people may consider traveling to nearby countries to access PrEP or order online. There's also the possibility that a level of distrust for government and public health services could hinder that acceptance of PrEP in Shanghai. And then the availability of resources in both countries would play a factor, especially for multilingual resources in Toronto. And my hope is that by comparing the two cities, it will also give us just better insights into how we can bridge the gap in linking PrEP and sexual health services to international students, newcomers, and those on temporary visas and permits. So now I can just outline some brief insights from what we see at ACAS. And as someone who was born and raised here in Canada, I don't have the lived experience of being an international student or newcomer, but I will be speaking from my own observations, themes that we see through our ACAS community surveys, and direct input from talking with these guys one-on-one. And so when doing this kind of work, I think it's also important to keep in mind how do you facilitate programming that's also accessible, inclusive, and inviting to international students and newcomers. So I think it was mentioned already, we are seeing a growing trend of new diagnoses, HIV diagnoses among those with temporary visas or permits that include refugee claimants, international students, and non-status. We've heard again challenges to accessing PrEP due to limited or no health insurance. I saw one story about accessing trans-friendly healthcare. We have had visitors here, temporary visitors, but that visiting could be for a year as well. It's not just a few months, it's for a year. And those who are here for that long will need to have their hormone injections. And there has been difficulty with finding a doctor who will take in new patients or temporary patients, or even without OHIP. So that is definitely a big barrier for transgender folks. Coming out, another big issue. Again, Sucre's story outlined one instance of what that looks like. where you might be out in Toronto, but not out of the closet back home, and you're apart from family. How do you come out, or how do you have that support with coming out when you're apart from your family? And then also with priorities. So when I was doing online outreach one day in Hamilton, to reach out to Asian guys to get tested at the local ASO, the AIDS network in Hamilton. And I was talking to a guy he had just finished school, and I was just asking him like, oh, has he ever heard of the AIDS clinic? Did he ever know that you could get tested there? He didn't. He's gotten tested elsewhere, but he didn't know that the AIDS network was readily available for MSM. And also I asked him how involved was he in the LGBTQ community, if he had any gay friends. And he said no, he never was involved in LGBT student groups as well, because his priorities was just school and work. And I believe I've also heard where people are just so focused on getting their citizenship status as well. So priorities makes a difference, and being able to advocate to be more assertive with sexual health, right, is important in this group. And then finally, I would like to emphasize the importance of language and culture in our work. Whether we were raised here in North America or immigrated, we are taught that we must assimilate or integrate into Western culture, or that we must learn English to succeed. And even sometimes unintentionally, we are taught that our language and culture is valued less than English. So I can see that this idea further impacting newcomers and immigrants in our programs. And this idea is sometimes so pervasive that when we held a social gathering at ACAS for Mandarin-speaking gay men, and I was there to host, but everyone else was Chinese. And they all insisted to speak English in order for the one and only English speaker to understand. And I tried to say that, no, this is for them. This is for their group. I'm just here to host it at the office. But yeah, they all insisted to speak English, which was, I think, silly, but it was there. The idea is there. So I think we have to insist, we have to push for people to speak their own language and bring it in. I've seen guys who don't access sexual health clinics because they believe their English is not good enough, even though to me it is. I talk to them in English. It seems good enough to me. Guys have also mentioned difficulty with dating due to cultural differences in the way they approach dating relationships. Again, newcomers have a much harder time feeling connected or included in the LGBTQ community. I dropped in at the investigator symposium last week, so one guy actually reviewed the Sex Now survey, looking at that data of how racialized groups feel less connected to the mainstream LGBTQ community. And then, so if we want to have newcomers and immigrants have those stronger connections here in our new home, it is not enough to fall on just the one Asian LGBTQ organization, but requires the work of multiple organizations together to actively make all our programs more accessible or link our programs together. So I just want to leave you with this one last thought, and that is, how can you actively incorporate and bring in language and culture into your work? Gamang, thank you.
Thank you very much, Ryan, Alan, Eugene. Those were incredibly profound presentations, which help us think about what it means to be an international student, to be part of this transnational community that is mobile, yet is here and sharing place and space with us. That's also a profound experience that speaks to our relations, our connections, and also our obligations to each other as we share the space together. And you brought up collectively really important issues on a broad scale, like the note that you ended on, Ryan, in terms of what does it mean for all these systems to be working together just as a brief example of universities that depend so much on the tuition fees of international students, mostly from Asia, with very little resources around sexual health or any conversations around cultural racism or sexual racism, to the concrete access to healthcare. So I hope that these are things that we might be able to discuss further in the Q&A, and I'd like to invite everyone here to join us to pose questions to our panelists, and we'll also be joined by Sucre as well, who told us about his individual life experience. So I'd like to ask you, the way we're gonna do this is if you could put up your hand or pose the question in the chat function, and then we'll take maybe 2 questions at a time and direct them to our panelists. Would anybody like to go first?
Looks like Michael put up his hands.
Hi.
Hi, Michael.
Hi. I actually have a question with the needs assessment for international students. Just for clarification, how did you folks qualify international students? Are they student permit holders? Does it include those who are in a work-study program? Are they university students? Are they language school? So just to kind of like give us a context on how we qualify or how you define international students in the research.
So the international students we recruited are graduated within the past 5 years or currently still in school. And it can include anywhere from college and university, and as well as, I'm not sure if some, yes, ESL schools. Does that answer your question?
It does, but I was wondering whether you find significant difference in terms of their needs between those who are in university, because Eugene mentioned a while ago that university has a UHIP program wherein they can access healthcare using their UHIP, as opposed to those who are here for a short term or on ESL schools wherein they don't have any insurance coverage.
We didn't discover like cross-check based on their school's insurance difference. We just have general questions. For example, what kind of healthcare do you have? Do you have family doctor? Are you covered by OHIP or UHIP? Those questions.
Yeah.
Okay, thank you.
I'll just add to that quickly. We haven't actually done the full analysis of all the data yet. We were really trying to pull some of like the things that we can present by the end of June. So like that is something we're hoping to actually look into. Thank you for bringing that up in our final community report that will hopefully release by the end of summer. So thank you for that.
Thank you.
So I have a couple of questions about the needs assessment. So when you talk about the PrEP, what percentage of the sample actually are on PrEP? I missed it. You were speaking so fast, Kai.
Sorry, yeah, I have a tendency to speak quite quickly. So actually, something that we didn't forgot to do was actually incorporate an actual question in the survey about it. So that was kind of extrapolated more from the actual interviewers. And so out of the 11 folks that we interviewed, only 3 have attempted to access PrEP and 2 were still on it. Yeah.
And then for the people who were using substances, I noticed that 12% say none of the above of all the drugs that were provided. Was there an other box for them to talk about what those none?
There was, and I wish I had prepared that list for you. But yes, there was an other option, and they were allowed to put others. They were allowed to fill in, yeah, whatever it was that wasn't on the list. I'm trying to remember too. I think sometime, yeah, I'll be happy to pull that out and make sure that that's included, because I think, yeah, it's important to highlight what is out there.
Thank you. I think we have a question from Andy.
Yes. Hi, everyone. My name is Andy. I know quite a few of you. Actually, it's interesting, Kai. Thanks for answering that question. I just wanted to build upon that before I was going to ask if it's okay if I share about our PrEP clinic at Maple Leaf Medical Clinic. But Kai, you mentioned that some of those participants, only 3 of them, were there any listed barriers as to why they didn't access PrEP or any other challenges?
Yeah, absolutely. So I was hoping somebody would ask this. So specifically, the main challenges were just the financial barrier. Actually, let me look at my notes real quick. The main issues were, in fact, financial barriers, not knowing how to actually access it, like where they can get it from, and also just essentially being satisfied with condom use alone. Like they were just saying how, like, I can use condoms, I don't need PrEP. So that was kind of the general gist that we were getting. But yeah, I think it's something very worthwhile to delve deeper into in terms of like what might be the actual barriers. But we did notice that, like, in terms of facilitators for it, again, that linkage to a doctor that's understanding of some of the international student experiences and the barriers, and also, like, I think what Eugene mentioned, being aware of the actual, like, some of the insurances and how they differ, and then what kind of programs might be able to support them. So yeah.
Just to add on that, in 2017, I actually tried to access PrEP. And before, like, the background is for me is before 2018, I was not involved in any LGBT or sexual health centers at all. So talking about like hooking up or like sexual health is awkward by that time for me. So when I went to the clinic and I asked information on PrEP, so the nurse started to ask me questions on like how many guys you hook up with, and then like how often, those kind of questions. So I didn't feel comfortable answering those questions like honestly. So I faked the number, and then to look back from today, I know the nurse was trying to assess my risk for getting HIV. So so then obviously the number I gave him confused him. Then he said, you don't need to be on PrEP. Yeah, so I'm seeing this just, I might not be the single case. So there are other people who may also be a little bit shy talking about this kind of thing. So just for you to consider.
Right. No, thank you so much for sharing that experience, Sucre. If I have the host blessing, if I could just share about the Maple Leaf PrEP Clinic, if that's okay with everyone. I don't know.
Yes, please.
Is that okay? Oh, okay. So hi to those. I'm Andy Mock. I'm a registered nurse. I work at Maple Leaf Medical Clinic and also the PrEP Clinic. We're located at 14 College Street, which is intersection Yonge and College. We do provide a PrEP clinic that offers STI services as well. And at that clinic, from what Kai mentioned, one of the barriers is accessing insurance and also the cost of medication. So we do offer a compassionate access program to help individuals who need access to PrEP and cannot afford it for different reasons. We provide them with medication if they're running out. We provide them with ways of accessing generic versions at a cheaper rate. And we also try and work with international students specifically who may not have insurance. So we work with the pharmacy and other avenues to try and get them generic versions of PrEP. One of them is through an international service that mails it to you. And the rate of that is almost about equivalent to, I think, $25 to $30 per month. So we do have that ability to support people in different situations and with different needs to access PrEP. And if people who need to speak Cantonese and Mandarin, I will do my best to work with you. My Cantonese and Mandarin is not fluent, but it's manageable. So we do have that service there, and it is open Monday to Friday. If you just go on Google and search Maple Leaf Prep Clinic, we can be directed there, and there's a website and everything. And I can also leave my email in the chat if people are interested in emailing me personally. But I'm also open to answering any questions if anyone has any about it.
Thank you, Andy. So we'll follow up with you in the chat. Thank you very much. We also have a question from Mitchell, and he just typed it. And he was wondering if there were any trans folks included in the studies.
So yeah, we didn't present the demographic data, but we did in fact have 2 trans men respond to our survey, at least for ours. That's our study.
Thank you. And I don't know if Eugene or Alan, if you'd like to discuss that.
Yeah, in our study, no participants identify themselves as having a trans experience. But one thing to note though is that 14 out of 15 participants, they identified as a GBMSM.
Great, thank you. And I think we have a question from Nulmuk, Executive Director at ACAS.
Oh, hi. Maybe people can see me. Yeah. My question is not directly to anyone, but I'd like to hear more about your experience with international students as part of your work, or any suggestion that you have for ACAS, because this is the best time to, we like to hear as well as the reflection, right? And the good work that people have been doing out there. Yeah, so that's my question. Yeah, thanks.
Thank you.
One thing I want to quickly say is that I think we need to put our advocacy efforts to change the narratives around the issues that international students are facing. I think we can easily frame it as a healthcare access issues, but I think it's really a health equity issues, because some of the things that students were talking about were that they even reached out to their school for support, but their school either was not responding or they were totally incompetent in terms of supporting international students. And I think from the perspective of, I was actually an international student myself, and I felt even then, I reached out to school for some support, healthcare support before, but I did not get any adequate support. And I just felt like I was being treated as a cash cow. And I think many students may feel that way as well. So one thing that's really important is that engaging schools as in the part of the process to, in our efforts to change the narrative to more empowering narrative, and so that the changes that we can come up with and implement are more meaningful and actually impactful to the students' health and well-being.
Fantastic, thank you. Sorry, Andy, did you have your hand up?
Yes. I also wanted to share some of the experience that I have working in the field. I kind of echo some of the same sentiments Eugene talked about in terms of international students. Some of them who are not attending university, if they go to certain colleges, their health insurance is also very different. And in certain circumstances, they cannot access the same types of healthcare services and benefits or drug coverage as the students who are going to a university. So there is that health inequity there. More so than that, I think a lot of international students are not able to find healthcare providers that meets their specific needs. More so than that, also they need to address how domestic students are not aware or able to advocate for international students' needs. There is that kind of separation of my friends are international students, but I'm not aware of what their issues are. So a lot of domestic students don't actually take I guess, the route of advocacy to support their international colleagues. So I think, something that ACAS may perhaps consider looking into is how do we also change the narrative for domestic students to understand the needs of their international colleagues, and how do we go about supporting them? Because unfortunately, international students are the cash cow for the education system, but they aren't actually a high number, enough to make an impact all the time in terms of advocacy. So I think that's, perhaps an avenue to explore and to see how we can better change that.
Thank you. That's really important. Do we have any other questions?
One thing I just want to also quickly add is that when I spoke to our participants, some of the things that consistently came up was the inconsistency in information that they find, or just the pure lack of information that they can find. Especially around healthcare, of course, because that's one of the biggest challenges that students face when they're faced with HIV. So one thing that I can suggest is that creating some sort of centralized knowledge platform that students can access to obtain information that they need.
So better access to information, ways that we think about people as people, not as dollar signs when they enter our education systems. Thank you. Alan?
Yeah, so I agree with a lot of what's been said, and I think I would actually love to hear from our participants. What do they think, as ACAS or community partners, we can do to eliminate some of those barriers? Because I think with the PrEP study, even though Ryan said we're not ready to share the data yet, we actually do have some preliminary data, and we know that there are quite a lot of access barriers, some of the ones that were talked about. But the more importantly, I think next step for us is to look at specific steps and things that we can do, right? So one of the things that we are working on with the OHTN is to develop information resource for international students. So that's in line with what Eugene is suggesting. So we're gonna connect Kai and Eugene and all of us together and work on that. But I think for the PrEP scale up, I think there's still a lot of things that could be done, and I would love to hear if people have any ideas.
And just a reminder, if you don't have your cameras on, you can also join us through the chat function if you'd like to comment or pose a question there.
And maybe when people are waiting, I can make another comment. So recently we did a consultation group for newcomers on HIV prevention and care. And that's when I was really reminded that our struggle hasn't really changed that much, because one of the young international student participant actually said that because he was so unaware or didn't have any hope of getting treatment that he didn't want to get tested. Which reminds me is that's like the narrative that we heard 30 years ago at the beginning of the HIV epidemic. We actually discourage our community to get tested because we think there is no treatment. And our students actually are feeling that way. So there's a lot of work that we need to do to change that narrative. So I think that speaks to importance of community support, information, awareness, and access, right? There's so much work that needs to be done. It just broke my heart when I heard that, because, it just took me back to the very beginning of the epidemic, and that shouldn't be happening.
Alan, could I ask, how do we think about the concrete steps, but also how it might feed into the bigger picture, say, of UNAIDS 1990 or the Toronto to Zero strategies?
So I think taking the health equity lens is very important. I think in a lot of the mainstream policy making forum, what people have been focusing is 1990-90. I think what the narrative really should be is about looking at the 10-10 and 10. who are the people who are left out of that cascade, right? And we need to prioritize and privilege the resources, attention, and programming to those populations. And I think the recent experience with COVID-19 highlighted the horror, of how vulnerable and marginalized communities are differentially impacted by COVID-19. It just unveils all the health inequities. It's the people who worked in the, most precarious settings that are getting infected. The people who lived in the most poorly resourced health institutions. Our migrant workers. So I think that's why it's so important to really look at it from that lens. We are very happy with, we're getting 88% of the 1990 and all this. But the bigger question is really, what are we doing for the other 10% of people? And unfortunately, a lot of our communities are in that 10%.
Thank you for helping us focus our gaze on that 10%. Are there any other questions? Okay, well then, I'll turn it. Oh, sorry, is there? Did I miss that?
Steve was trying to say something.
Oh, okay. Sorry, Steve.
Sorry, I was trying to find the hands up button, but I was having trouble. I'm curious if this came up at all during the needs assessment of how and when schools are sharing resources with students, if it's like a continued sharing of resources, or if it's just sort of once during the orientation week on campus when things are quite hectic and they're moving into schools, and what's the, like, when and where and how are resources being shared?
That is a great question. When we didn't, I guess when we were asking, we tried to, it was supposed to be a semi-structured interview. And so in our set questions, we were kind of asking what types of resources you were accessing on campus. And interestingly enough, honestly, from most folks that we spoke with, all we really heard was that they didn't access resources on campus. Like, it was just not something they actually looked for. But it's actually interesting. I'm surprised that nobody actually mentioned, but Sucre did talk about it, like just being overwhelmed with information. But from our actual interviews, from the ones that I remember doing and from some of the transcripts, it was pretty much people saying that they didn't bother really. And I wish we kind of dove into that a bit more. Sucre and Liam, did you remember anything from your?
I have something to say in the breakout rooms about that.
Oh yeah, we really should have.
Liam has something to say. Lim was sharing some of the stuff in the breakout rooms about information. And when people get these things, maybe he can respond.
Yeah, Liam.
Yeah. Because school do have workshop for information, but most of them didn't check school email frequently, so we don't know about the workshop access. And even though we don't want to go there because they also speak English and we don't understand fully about what they say, so that's the reason why we didn't want to come to workshop at school. Yeah.
I actually do remember too, Liam, we had a conversation about something similar to this, about how it seems like all the kind of information sessions were clumped up at the beginning of the term. And then so while I think the experience of like juggling and learning about everything that's available, you kind of miss a lot of things. And you end up not attending them because there's just so many different things you'd rather be doing. So I think that's another interesting factor that's worth considering when you're planning for events.
Well, speaking based on like experience, there wasn't really anything given to us in George Brown. And then I also had like friends in UT, and then like it was the third year he was in U of T, and then I brought up STD to him. That he was like, "What is that?" And I kind of introduced this guy to sexual health and the testing. So I guess for U of T, it's I'm not sure if information were given, but definitely it was not something noticeable or like within buried in a PAL file, those kind of things.
If I can add to that whole point about information sharing, and I think it seems like if information is shared at all by school, again, like it may be done in the beginning, and school may be kind of treating it as a one less thing to do. So just kind of tick a box and say, okay, we did it, let's move on. But I think that kind of shows like how the impact of that is that there's an inconsistency in sort of access to information. So one thing, again, maybe ACAS can help in initiating this is that creating some sort of a collaborative partnership with school so that the information access strategies and engagement strategies is more active and actually meaningful, and it's actually meaningfully contributing to the international students' health and well-being.
I think Michael also wanted to add a point.
Hi, thank you. I think one of the things that came into mind while listening to the three kind of like projects that was presented today is that as much as we want to look into this research in a health equity perspective, it might be worthwhile to center our analysis by understanding culture and race as a center or as a focal entry point in analyzing the research, because at the end of the day, what is common with the experiences of international students is this kind of like hesitation to access because they don't speak English. They don't want to access because they don't understand. They don't want to access because they're experiencing stigma among their family members or among their peers who are LGBT. A lot of them are also like not out as a gay man, right? So as much as we want to look at it as an equity lens, we should also kind of like try, maybe worthwhile to enter it with the analysis of culture and race in mind when we're reading these results or research.
Thank you for that suggestion about how to find.
Can I say something?
Yes, Noma?
Yeah, thank you for sharing. And I think I was struck with the word cash cow. International students are a cash cow of many colleges and universities at this point, right? And we know that the numbers could be 40 or 50% enrollment, and bringing bringing money into this country. I also, yeah, I agree with Andy about the advocacy part, the campaign part, and the practical side of it, right? Like where we can provide information, when to get access. At the same time, looking into a broader picture, and I think people heard me saying it a few times, that Canada doesn't have, especially HIV prevention, education piece on mobile population, because that's a broader umbrella of people that who marginalized here, like migrant farm workers, the truck drivers too, that like I don't think any agencies work with them, right? Because they mobile, they travel over Canada, and also international students, people on work permit, and temporarily migrant workers, not only migrant farm workers. So I think that's another area that we should look into. Mobile populations and HIV concepts are very common at international level, right? But the government here doesn't see as an issue at this point. But I think COVID-19, as Alan said, already brought out the marginalization, health equity issues, and also problems that hidden, right, that it brought out into the light. So I hope that we continue the conversation. I don't know how, because ACAS is very small, but if we know, yeah, for sure. One last thing, there's a group called Migrants Workers Alliance for Change, and I think there's an emerging subgroup within this network that work with international students and migrant workers on the labor part, right? Yeah, because international students also work here and contribute to the economy. Yeah, and I'm talking as a former international student long time ago, right? Yeah, so it's like it resonates with my experience, especially the first year is very difficult for everyone.
I just want to add something from Mitchell, who is here in Montreal. And he's written that he works in a nonprofit sexual health clinic in Montreal and has found this seminar or this presentation really helpful in terms of modeling services for international students, and that they receive a high volume of international students. So it's incredibly relevant to their work, and he thanks you all. In the interest of time, I just wanted again to say thank you to everybody. And thank you especially to ACAS for the work that you, even though you're, as you say, Nilmuk, small, the work that you do is so connected to the community that you're always on the pulse or the cutting edge of what's happening. And thank you again for doing this work as you always do, that difficult work of being on the edge. I'd like to turn it over to Kai for closing remarks.
I'll try to talk more slowly now, Alan. Yeah, thank you all so very much for that incredible conversation and discussion. And thank you to our panelists, Alan, Eugene, and Ryan, and also Sucre, and also Nalini as a moderator. This has been very insightful, and as somebody who is going to be helping tackle the final report, it's been really great getting some of your feedback and also just some of the ways that we can go about doing the analysis. So just to wrap up, we did want to acknowledge and thank the Toronto Urban Health Fund for giving us this opportunity to pursue this project. And in the same vein, again, we also want to thank all of our volunteers, our board of advisors, again, our speakers, panelists, and obviously everyone here as well. Without you, this event could not happen. But I guess I'm also responsible for chatting about what our next steps are going to be, and specifically from ACAS's perspective. We're going to try to synthesize some of the things that we heard today, whether it's from the group or the chats, or also from the conversations we had. And we'll try to take that forward in our analysis of the final report. After this immediate event, I'll probably circulate an email out to everyone who is in attendance today. Eugene sent me his slides, and I know that he has some PowerPoint issues, so we can hopefully get that out to everyone. And Ryan also mentioned about the Shanghai PrEP study, so hopefully we'll be able to get that out to folks as well, if you know anyone in your networks who might be interested. But apart from that, we'll also be sharing the video link for this event once it is processed and downloaded. And then I also mentioned this briefly a little earlier. We're also going to be working on a final report, a community-based report for this project, and we'll do a lot more of the breakdown of analysis from the demographic data that we omitted, but also some other interesting pieces that we noted that we couldn't have. We knew we wouldn't have time to share today. So please look forward to that, and we'll send that out as well to everyone. Additionally, as ACAS is a smaller agency, we do welcome and are very happy to collaborate with future efforts. If anyone is doing work in this area, and maybe you do work with a lot of international folks who are from East and Southeast Asian backgrounds, we would absolutely love to assist in any way, but also to collaborate in any future projects. So I think that concludes my remarks. I don't know was that good, Noma? Is there anything else we wanted to say? Okay, great. I got the thumbs up. So thank you all again so much for your time. If you have any additional questions, or if there's anything you want to reach out about, my email is, well, you all have my email. I sent you all the emails, but please feel free to reach out. I'd be happy to answer them, and we'll be circulating our slides and everything. So thank you all. Have a great day.
Thanks, Zach. Thanks, Alex.
Thank you.
Thanks, Kai, everybody, Sucre, Liam, Alan, Nilmuk, Eugene. Thank you.
Thank you.
Thank you.